All right, welcome back to the Central Valley Buzz, everybody. I'm your host, Chuck Leonard. Let's bring in Neal Howard from InnovaRx. Neal, how's it going, buddy?
It's going pretty good.
Good to see you again.
How are you?
For the people that haven't caught you on the show before, tell them what you do, what InnovaRx is.
InnovaRx is what we call a medication therapy management program. It's aimed at helping people manage their meds better, take them more consistently, with the goal of eliminating or driving down health costs and saving unnecessary drug-related emergency room visits and hospitalizations. I try to do it on a personal level, meet with the patients in their own homes, one-on-one, want to go to their office visits with their physicians to make sure that those things are clear when they come out of there, and kind of go to the emergency room and provide information for those physicians there, and then bridge the gap between their discharge from the emergency room and that proverbial first visit they're supposed to have with their primary care that sometimes never gets done. So trying to fill the gaps with simple things rather than...
Why did you feel it was necessary to start this company?
Well, I had some personal experience with my in-laws when they were in their last few months, and my wife and I were doing the normal family things, taking them to office visits, spending numerous hours in the emergency room. And I just decided when I was going through it with them that there's really nobody to advocate for that particular population, especially with drug-related problems and issues that seem to be high anxiety for caregivers and family members. So I decided that I would stick myself in the breach there and see if I could help, because I was a pharmacist for 40 years, recently retired, and I thought that they needed someone to advocate for them in those issues.
Explain to me the need and what the problems were.
Well, I think there
are. Right?
Well, yeah, the problems are that there are a lot of patients that end up in emergency room and hospitals because they have drug-induced conditions.
Like taking too much, not taking it at all?
Either they take too much or they decide they're healthy and they don't really want to take it, or there's an element of denial. I'm really not sick. I don't need to take these medications. And because they don't do that or follow up, they end up back in the hospital. And there's a real need there to prevent that. And
are we talking about mostly elderly?
Mostly elderly, yeah. My experience was with my in-laws. They were in their early 80s.
Mm-hmm.
But I think the service crosses the spectrum, over the spectrum. If you have a lot of, taking a lot of meds, seeing a lot of physicians, doing the multiple pharmacy thing, then I think I can help.
When you say the multiple pharmacy thing, you're talking about people that get a prescription from their doctor and they're doubling up, tripling up?
Not some of that, but most of the time they go where they can get the best price or where their insurance company will pay for the...
So the pharmacist doesn't know that they're taking these other drugs over here, so it's okay to fill this one?
Well, pharmacists are pretty knowledgeable about what happens with their patients relative to what's on the profile. Sometimes they're not aware of all the things they take, whether it be supplements or OTC meds and prescription meds, and they mix them together. But a lot of people shop around for pharmacies, just like they shop around or they're sent to different physicians who are specialists. So they end up going to 2 or 3 different places. And it kind of creates confusion because there's not a good link between one pharmacy and the next, and another physician and another specialist. We claim that there is, but we know there are gaps there. So
you're not necessarily talking about people that are abusing these drugs on purpose?
No. I mean, we know that's a problem too, but I'm not really aiming at that. I want to make sure that the people who are normal overutilizers, the people that tend to get most of the care, take most of the medications, that they're taking them properly, or that they're getting their best out of what they're taking. And that will also help the physician as well, because if they don't pick up a prescription or they don't know they're not taking it, they usually take the therapy to another level without really having that knowledge. So if I can provide that by saying, well, the last 3 months, the patient 3 months ago when you prescribed the medication, they didn't pick it up because for whatever reason it was, they just didn't want to pick it up. And now that they're still out of control, you want to add something, but let's go back to the beginning and say, let's make sure they pick it up. Let's work with them and create some tools for them to use at home to make sure they take it right.
You ever get doctors that are kind of like, hey, oh, wait, I'm the doctor here?
Actually, over my 40-year career, I did have someone once tell me that they were the doctor and I was the pharmacist, which is not the best thing to be in, but I know there has been some adversarial relationship between pharmacists and physicians over the years, and I hope to have an attitude that will eliminate that in the project that I want to do, that they'll be open to having me come in and help with their patients.
So, the people that are watching out there, who should be calling you?
If the patient themselves doesn't call me, then caregivers, family members like myself. My wife and I'm in my late 60s, so they were in their 80s, and sometimes that burden of care falls on one member of the family. My wife has two sisters. My wife was the executor for my parents, so it's basically for the family members or someone who they've designated as a caregiver to help them get the patient going and make sure they're taking these things right. So I would appeal to baby boomers, my own, who have parents who are getting into their elder years. We've had several friends. We all have gone through the same thing with our parents, having issues with this, and most patients will get medications for one reason or another. So there's always a link between that and all the other therapy, and so I would appeal to those people that are baby boomers that are like myself, who have either in-laws or parents that are getting elderly and they're taking meds and they really don't know what to do about it. There's issues.
Does insurance recognize your services?
Some insurances do. It's on an individual basis. If someone had an insurance and was dealing with me, I would call the insurance company to find out if it's paid for. If it is paid for, then we would make sure that they would get billed and reimbursed. If they don't pay for it, then obviously it would be done private out of pocket. But there are insurances that are paying for it, because this is kind of the profession itself is going in this direction. They're training students to do this direct primary care with physicians. So it is coming on a national basis. So
I could see this getting really popular in the future.
Hope so. I'd like to be the first one in the area. There isn't anybody doing it in the area. I'd like to be the first one in the area to do it and help the community get healthier and more aware of medications.
Neal Howard, thank you very much for coming by.
Thank
Always
you,
good
Chuck.
to see you, buddy.
All right.
We're going to take a quick commercial break.